Okay, so we're going to talk about what I call 3 phases of chronic Lyme. So I know anybody that's had chronic Lyme, you've well educated yourself. There's a lot of information on the internet. You've studied a lot about chronic Lyme. You feel like you got a handle on it, but you're here because maybe there's something else you could learn. So I apologize in advance if you already know everything that I'm going to say. But I'd be willing to bet there's going to be something I'll say that will be an enlightenment to somebody here. So the first phase of Lyme disease is that acute infection. So we're not going to get into, is it the Borrelia burgdorferi, is it the co-infections, is it what? Because I've never seen a chronic Lyme patient that hasn't had multiple co-infections. So right now we're going to talk about how to deal with these different phases of chronic Lyme, how I deal with them in our office, and the treatments that I would suggest and not suggest for a chronic Lyme patient. Number 1, in the acute infection stage, I always recommend antibiotics. The problem is that we don't always know that if we've been acutely affected. So not everybody gets this perfect bullseye reaction, not everybody gets this flu-like symptoms, and you only recognize that you have Lyme disease when you're already in a chronic or later stage. That's the difficult thing. And thank you to the representative here that's getting things passed so that patients can be in an acute phase and get into the doctor and say, I think I have Lyme disease, I got this bullseye rash, I got this fever, I feel super sick, it's in the middle of the summer, I don't think I have the flu, and their doctors aren't quite so afraid of giving them an antibiotic prescription. Because as you know, if they go, oh, we got to run the Lyme test, which is only about 30% accurate in the first place, and they run the Lyme test, and it takes 3 weeks to get back, you already may have moved past the acute stage. The acute stage of a Lyme infection is when it is still in a bacteria, it's always a bacteria, but when it's in a true bacterial phase. A bacteria is the only thing that can be killed by an antibiotic. The reason why viruses can't be killed by antibiotics is because viruses are smaller and they have the ability to go inside of a cell. So normally, if any pathogen, that's anything that you're infected with, goes inside of a cell, the cell puts up this marker on the outside of the cell that tells the immune system that it has been infiltrated, and then a macrophage, or some white blood cell, is going to surround that cell and destroy that entire cell, and thereby kill that virus. So in a viral infection, you need an immune response to kill it, because if you take antibiotics, antibiotics aren't going to kill a virus. The problem with Lyme disease is that it's only killable with antibiotics if it's in that bacterial phase that hasn't yet gone inside of a cell.